Say data on race and this virus is too limited now to draw sweeping conclusions, but in some places the illness is infecting and killing more African Americans than others. Here's News Channel 6's Ashley Flette.
There is now an alarming rate of African Americans being infected with coronavirus. That pushed us to ask the question, why is COVID-19 killing African Americans at a disproportionately high rate? Obesity, high blood pressure, and type 2 diabetes are all more prevalent in African American communities, which are considered risk factors for coronavirus outcomes. I sat down with Department of Family Medicine Dr. Joseph Hobbs at the Medical College of Georgia about why that is.
I don't think that we should be surprised, because if we took COVID-19 and put it aside and just look at African Americans in general, or any disadvantaged minority group in our country, there's already, and we know this, a health disparity that exists there.
Dr. Hobbs says it goes beyond underlying conditions.
Because they have jobs that don't pay as much as the general population, and in fact those jobs often are essential jobs in service areas, and for them the whole idea of trying to socially isolate themselves becomes difficult because they are part of the essential workforce.
He says think of it deeper than just in the medical aspect.
They live in homes that may be smaller than the general population, and so therefore it's very difficult to segregate the members of the household from each other, especially if one member of that household is having to leave, going into the public because they are an essential employee, coming back. They cannot segregate themselves in that setting.
Dr. Hobbs has practiced medicine for 45 years. He says this is not the first outbreak of its kind.
But history has told us that these things come about in cycles, and because of that we need to be prepared. And I think that the world on this particular cycle was woefully unprepared.
Dr. Hobbs says some healthcare professionals are not surprised of COVID-19 numbers and that of African American cases, but he says it's important to note the difference of degree. In Augusta, Ashley Flette, WJBF News Channel 6.